Okay, guys, so we are welcome to the class, and this is Psych 223. That's the course code for biological psychology in the University of Ghana. And we are continuing from where we paused our face-to-face class during the weekend. So today we'll be continuing from question number 20. Question number 20. So if you're seeing me for the first time, my name is Siddik Salis, and this is the Faculty of Intellectuals. For those who will be watching this on YouTube. Okay, so without wasting of much time, let's go to question 20. It says synaptic pruning. I think we've done that already. What is synaptic pruning? That's cleansing of some neurons from the nervous system. Okay, so I think we've solved that already. Let me see the possible answers. So growth of neurons. So pruning is not about growth. Reduction or removal of neurons for efficiency. Yes. So that is pruning. Okay, there's noise at the background. So kindly mute yourself if you haven't. Okay. Let's continue. Okay. So it means today we are continuing from question 21. Says nicotine is a stimulating drug, and it is therefore associated with which of the following? Now, nicotine, as we mentioned the last time during class, the last time we talked about tetrahydrocannabinoid and marijuana and the rest, okay? Now, the question has even fed you with something here. It says nicotine. It talked about nicotine, and it told you what nicotine, which type of drugs nicotine is categorized into. Now, if you remember, guys, if you remember, we categorized drugs into two major parts: stimulant and depressant. We talked about the activities of stimulant drugs at the synapse or in the synapse, okay, and that of depressant and what they do. We said either they are antagonistic or they are agonistic. And I'm hoping that I'm speaking as if you understood, or I'm assuming you've understood what we discussed during class the last time. Okay, so back to the question. It says nicotine is a stimulating drug, okay, meaning it facilitates the process of neural communication, okay? It doesn't inhibit, it rather excites, okay? I mean, its chemicals excite. Says that nicotine is a stimulating drug and it is therefore associated with which of the following? Would you, if, how do you call it? A drug is a stimulant drug. I drew something the last time, stimulant and depressant, okay? Then under stimulant, I indicated that they go with excitatory at the synapse, okay, when it comes to neurotransmitters. And then depressant usually goes with, how do you call it? Inhibitory. Okay, good. So if we understand this, and I told you to read about the drugs a lot. Okay, so who can tell me, you can unmute yourself and talk, who can tell me that will you categorize nicotine, which is a stimulant drug, under GABA or acetylcholine or dopamine or resin? Which of them will you categorize nicotine under? Who can help with that? You can unmute yourself in case you're talking. You can unmute yourself and answer that. And don't worry, your name will not show. So don't worry.
I think I'll go with A, acetylcholine.
Are you sure? Okay, not too far from the truth. But there is one that normally goes with stimulants. It's like a major Just like GABA is major for inhibitory. Okay, so let's not waste time. The answer is dopamine. Okay. Or you've seen acetylcholine somewhere? Hello? Did you read acetylcholine somewhere?
I'm trying to, I think so, but I'm trying to locate it from the slide and
Okay.
share
I
with
may also
you.
be wrong, so cross-check it, but I'm going with dopamine.
Okay.
Okay, so let's go to question 22. If both parents are recessive for sickle cell, what are the chances of them producing a child with this disorder? If both parents are recessive, not dominant, they are recessive, what are the chances of them producing a child with this disorder? Who can help with that? Is it 25%?
25%.
That's correct. That's 1 out of 4 children has the chance of being inheriting the disorder from them. So that's 1 out of 4 children. That's 25%. Okay, I hope you're good with that. Let's go to question 23. Sorry. Okay. It says the fovea is the part of the retina that contains photoreceptors called, so this has to do with how do you call it? Visual sense. The visual sense. It says fovea is the part of the retina that contains photoreceptors called, if someone knows, just unmute yourself and answer. If not, then we answer and we move forward. Okay, so the answer is cones. Okay, the fovea it contains some photoreceptors, and those photoreceptors are called the cones. Okay, so let's move to question 24. And I hope you are taking notes. Let's move to Abigail.
Yes, please. I think I found
The nicotine.
nicotine
Okay.
something, but let me read it out to you so that
Okay,
you
sure.
check it.
You
So
can bring
under
you can
stimulant.
bring your hand down whilst you're doing that. Your hand is still up.
Okay. All right. Let me.
Okay.
So, hey, I'm power. Let me say.
It's dopamine, right?
Wait. Oh, wait. Yes, I think so. But let me read for you.
Okay.
Nicotine comes from cigarettes. Stimulate one type
It
of
comes from what? It comes from
acetylcholine.
what?
Cigarette.
Yes. Okay.
Stimulate one type of acetylcholine
Mm-hmm.
receptor known as nicotinic receptor.
Mm-hmm.
Nicotinic receptors are found in the central nervous system, the nerve muscle junction of skeletal muscles,
Mm-hmm.
and in the nucleus accumbens that facilitate dopamine release.
Mm-hmm.
So
So
that's just
the,
that, but I don't know which
so the nicotinic receptors facilitates the release of dopamine. So you see, so let's read
yeah.
the question again. That's question 21. It says that nicotine is a stimulating drug and it is therefore associated with which of the following? Okay, so since it didn't talk about what it facilitates or excite or whatever, then let's go for the acetylcholine then. Because in the slides, just like you read, it was associated with acetylcholine. So I think
Okay.
you are right on that.
All right.
I think we've answered question 23, right? That the fovea is the part of the retina that contains photoreceptors called cones, right?
Okay.
Okay, we've answered that. So question 24, Broca's aphasia. Then we were reading certain question. Where was that from? Okay, we are still okay. Okay, question 24 says Broca's aphasia is the inability to produce speech. Which brain area is affected? Okay, so Broca's aphasia, where can we locate that in the brain? Now, let me make my question clear. When I say in the brain, let's divide the forebrain into four. There are the frontal lobes, the parietal lobes, the occipital lobes, and then the temporal lobes. Where can we find the Broca's area? Although it's like I'm answering the question already. Who knows where we can find it?
Please, can you scroll up for us to see the possible answers?
You will not see. I intentionally left it like this. Okay, I'm asking a question. So the Broca's area, we have the Wernicke's, or what is called Wernicke's area, and then the Broca's area. Which part of these four parts that I mentioned can you find the Broca's area? I said the frontal lobes, parietal lobes. Good, temporal lobes. Why? Because they said it's related to what? Production of speech. Right. Okay. So now the question is, Broca's aphasia, meaning inability to do something. When you say aphasia, that's inability to do something. Aphasia is the ability. Aphasia is like the inability to do something. This is the inability to produce speech. Which brain area is affected? So now let's go to the possible answers. We have the occipital region, the spatial areas of the brain, the parietal region, and then we have the temporal cortex. So the answer is the temporal cortex. So that's the answer. Now you know why I didn't want to scroll down. Abigail.
Yes.
Good. Okay, so question 25. Says the left hemisphere controls the right side of the body. This question, it's so like glaring. It's so suggestive. It suggests its answer by itself. So if you don't get it, please, Saturday, don't go and sit in the class. Come and let's go and chill. Says the left hemisphere controls the right side of the body, and right hemisphere controls the left side of the body. So let me demonstrate it to you in case, I know we have living legends. It's saying that this brain divided into two. The right hemisphere, the right side, controls the left side of the body. And the left hemisphere controls the right side. So it's like X, it's like an X shape. Okay. After suggesting that, saying that clearly to us, then it says an individual had a stroke that has caused damage to the left hemisphere. Now, what is the likely behavior effect? What would be the DV? What would be the dependent variable? Okay, so the answers are, he's unlikely to walk, but will be able to talk. B says he's likely to be paralyzed on the right side of the body and unable
The answer
to
is
talk.
B.
Okay, you don't want me to read the rest there.
Simple.
Okay, so the answer is
Is
B.
B.
So that's why I said this one, anyone who doesn't get this question, the person should go and collect the balance, his fees, and let's go and chill. Okay, so 26. Question. So in case you didn't understand, if you read the question again, the 25, you will understand. Okay. They said an individual had a stroke that has caused damage to the left hemisphere. And I said, imagine it to be the X shape. So if the damage is on the left hemisphere, what do you think will be the DV? What do you think will be the likely behavior effect? B says he's likely, now since the damage is on the left, it says he's likely to be paralyzed on the right side of the body and unable to talk, because the left side, the left hemisphere, how do you call it? That's where you also find the Wernicke's area and the Broca's area, okay, which is responsible for the production of speech. Okay. Question 26. The structure that allows communication between the two cerebral hemispheres is called the, now let me do something for you. I'm going to type the answer, so don't worry. Okay. Can you see what I've typed? I wanted to show you something. Can you see what I'm typing?
No.
No.
Oh, okay. Then let me share it for you. Oh, where is this then? Okay. Stop share. And let's share again. Can you see now? Guys, can you see now?
Yeah. Yes.
Okay, so I'm about to show you something. Let's answer the question first, then we come back to this. Let's answer the question first.
Okay. The answer is corpus callosum.
Yes, corpus callosum. I just typed that for you. Okay, so there's something called a structure called corpus callosum. As you can see, corpus callosum says that's the structure that allows communication. Okay, it holds the two hemispheres together, and that's what facilitates communication between the two hemispheres. Okay, that's what holds them together and facilitates communication between the two. So that's corpus callosum. That's A. Now let's go back to how it looks like. Okay, so that's it. So if you look at the brain here, you can see my arrow, right? My hand.
Yeah.
Here you can see it here. On this side, you can see it here clearly. Now, so this where the two hemispheres is joined and they have their communication. If you come here, you see it in the green shape and all that. So that's the corpus callosum. Okay, that's enough. Let's go back to our questions. Okay, so question 27. Why is contrast used in CT scan? Here, we don't have to waste much time anyways. What's the answer? Why do we use contrast? When you say contrast, you know contrast, right?
Yeah, to enhance a particular tissue.
Exactly, to enhance something to appear clearer or visually plain. So it says, why is contrast used in CT scan? Who can answer this? A says to suppress particular tissues. B says to enhance a particular tissue. C says to ensure correct tissue is being imaged. And D says to reduce bone interference. What do you think is the correct answer?
B.
Are you sure? To enhance a particular tissue?
I'll go with C.
C, yes. I think the one who's Jasper who said B said wanted to say C. To ensure correct tissue is being imaged. Is being imaged.
Okay.
Yeah. Okay, so 28. Christina is 28 years old and have delusions and sometimes hears voices. Her medication is regulating what type of neurotransmitter? Now let's keep calm and take the question again. Now there's a girl called Tina, so anyone can be 28. Oh, calm down, be calming down. What we are interested in is not just A, B, C, D. So be calming down. We know. By this time, that's Bridget. The one who said B is Bridget. Because for her, she even completed the Passco before seeing how the slides looks like.
That's like.
Okay, so it says there's someone called Tina. So there's a person, okay? And the person has delusions and sometimes hears voices. So I'm trying to make the question clear to you so that you wouldn't be expecting the exact question in the examination hall. When you didn't see Tina, you'll be like, when you didn't see Tina, you will go and you will not see 28 years old. You'll be like, the question didn't come. So anyone at all. So when there is delusions and hearing of voices and all that, these are some characteristics of schizophrenia. Okay, now it says that her medication is regulating what type of neurotransmitter? And someone said the answer is dopamine. That's correct. When dopamine, the release of dopamine is in excess, this can cause delusion, okay? It can cause delusion, either delusion of prosecution or delusion of grandeur or delusion of self-grandeur. That is, delusion is of two types. That is, either you're having a delusion that someone wants to harm you, people around you are evil and all that. That's delusion of prosecution. And we have delusion of grandeur, self-grandeur, where you think yourself of so much positivity and highly rated that you can save the world and that you are so relevant in society, and the way you carry yourself, you think that is how society sees you, meanwhile no one has even seen you. So that is delusion of self-grandeur or delusion of grandeur. Now, what is making all this excessive thinking? That's excess release of dopamine, as we talked about the last time in class. Okay. So when you are giving the person medication, you give the person a medication that has the neurotransmitters that will control the release of dopamine, okay? Will regulate the release of dopamine. Okay. 29 says autism spectrum disorders are characterized by, when someone has autism, what are, how do you call it? Some of the characteristics that we can find. A says difficult with both language and communication. B says the inability to understand the rules of grammar. C says the inability to produce speech. And D says difficulty learning more than one language. What do you think the answer is, guys?
I think it's either between A and D.
A, okay. So the one you mentioned first is correct. A.
A.
Yeah, difficulty with both language and communication. Okay, so let's go to 30. I'm just rushing these objectives because it wouldn't be much of a problem. The problem will be when you don't understand the questions and you don't understand the answers. That is a problem, because you go to the examination hall and there will be a bit twist in any of the question and you'll be like, I've never seen this question. But if you understand the questions, then you realize that no matter how they'll twist them, you will understand them and you will know the answer. The problem will be after 40, when we are done with question 40, which you guys have agreed that tomorrow we'll be meeting in class in person so that we discuss them, such as what is neurotransmitter. Although we've talked about it already, but you may also know it in your mind, but how do you put it on paper? 2, select one neurotransmitter and describe its effect in the nervous system. So these questions will help us revise what we've learned already. What is executive function? When we talk of the hemispheres, or when we talk of the forebrain, or when we talk of the brain in general, we have something called executive function. What do we mean by executive function? What is the role of the thalamus in the transfer of sensory information to the cortex? Okay. This is known as transduction, but we'll talk about it when we are transferring sensory information to the cortex. Okay, so this, yes, to the cortex. That's a transduction. But what is the role of the thalamus in doing this? Okay, so we'll be talking about things like this, God willing, tomorrow in the class. The primary function of the parasympathetic nervous system. We'll talk about this already in class, but then these things will help us revise more. Now, let's get back to question, I think, 30 or 31. So this is the reason I'm rushing this part of the questions, because I'm believing that it should be easier for us. Also, so question 30 says, which of the following neurotransmitters do you think his body? Now, this question is actually not a question for me. It's not a question because we don't know who the question is referring to. Maybe some of you know, but I don't know who the question is referring to. Says, because the first one is not he. I think we'll be going off in the next 10 minutes. So the first question is not he. The question that preceded, that's Tina. Okay. And the 29 is not even talking about someone. It didn't specify a gender. So when the 30 says, which of the following neurotransmitters do you think his body is producing, but in abnormal amounts? I'm like, hello, who are you talking about? And have you discussed the characteristics of the person already? I don't know if some of you know what this thing is talking about. You can answer, then we move on. If you know, just unmute and answer, then we go. Because for me, I don't know whom the question is talking about. Anyone with an answer? And there was silence. Okay, so let's go to 31 then. That one says, if an individual is receiving treatment for an ailment and the medication is supposed to regulate serotonin or dopamine, which of the following disorders is he likely suffering from? So if someone is receiving treatment, okay, for a condition, for a disorder, okay, and this treatment is to regulate the activities of serotonin or dopamine, then what do you think the person is suffering from? Now,
I think C.
Okay, so let's start from A. A says, okay, A says depression or Down syndrome. Depression or Down syndrome that don't have really excessive serotonin or dopamine, so that's out. B says ADHD. Who knows the full meaning of ADHD? So
I think attention deficit hyperactivity deficiency or something like that.
Hyperactive disorder. That's the last
hyperactive disorder.
Good. That's great. Okay, so that's it. Attention deficit, so stroke, hyperactive disorder, or autism spectrum disorders. And all these things don't necessarily come with an excessive release of dopamine or serotonin for you to say you are given a medication that will regulate it. C says schizophrenia or depression. Schizophrenia or depression. Okay, so the regulation is C, or D?
C, because serotonin gives depression and anxiety, something like that. And then the dopamine also, excess dopamine gives can lead to schizophrenia.
Okay, so when there's excess release of dopamine, it can lead to schizophrenia. That is delusion and all that we talked about, right? Right?
Yes.
And when there is less dopamine as it's supposed to be, or serotonin as it's supposed to be, that will lead to depression. Is that correct?
Yeah. Yes.
Okay, so then we say it depends. So the answer is yes. You guys are correct. The answer is C. It depends. If it's less, if they are less in the system, it will cause depression. If they are more, it will cause schizophrenia. So when we are regulating them, we are giving a medication that is regulating them, then the person it's either suffering from schizophrenia or depression. Let's go to question 32. Yo, Fafa, are you going?
Yeah.
Yo. Okay, question 32. If the left hemisphere is removed in children, recovery of language function is dash. Yo, Andrew, what now? If the left hemisphere, I beg, mute him. You guys should mute yourself. If you're about to talk, then you're muted. If the left hemisphere is removed in children, Recovery of language function is dash, whereas in adults, it would be dash. Okay, so let's read it this way. If the left hemisphere, we know what the left hemisphere does, right? It's removed in children. Recovery of language, because that's where the Venicase area is and all that. Recovery of language function is dash, that is with regards to children. And what of adults? Is it impaired? The recovery of language will be impaired in children and will be relatively normal in adults. Is that the answer?
I'll go with D.
No, it's D.
Okay, so with children, it
Relatively
will be
normal in
the
children,
opposite
yeah.
rather. It will be the opposite of A. That is relatively
Yes.
normal with children and impaired with adults. Is that correct?
Yes.
Yes.
Hey, I'm on for. Mabio. Okay. Yes, Mabio, but more serious. Enemy problem. Okay, let's continue. Which of the following infections or diseases is likely cause neuropsychological deficits? Okay, so there is a disease or infection, okay, that cause neuropsychological deficits. Is it malaria? Is it kidney failure? Is it
it's C, meningitis.
Meningitis.
Okay, meningitis. Who knows what meningitis is?
I can see.
Or bisa say Google.
Isn't the meningitis around the brain, the like I think the fluid area there?
The meninges. So
when
there's an inflammation in the meninges, that will cause how do you call it? It affects psychological activities. That's neuropsychological deficits. We call it neuropsychological because there's a fluid, there's some component, physical component, physiological components that is leading to this psychological disorder. Okay. It's called MS. That is multiple sclerosis, or what do you call it? Yes, sclerosis. Multiple sclerosis is caused by the breakdown. So it's telling us what causes MS. That's multiple sclerosis. It's caused by the breakdown of a specific element of neurons. So when there's a specific breakdown, when there's a breakdown of specific elements of neurons, it causes or it brings about MS, that is multiple sclerosis. Which of the following is the correct element? Which element is there that when it breaks down, it will cause MS? A says neurotransmitter receptors, B says cell body, C says myelin around axons, and D says synaptic vessels.
C. C.
Vesicles. So the answer is C, the myelin around axons. That's the myelin sheath. When the myelin sheath breaks down, it will cause MS. It will cause multiple sclerosis. So that is it. Question 25. Like I said, if we go off, we'll come back in some few minutes with the same link. Okay, 25 says language production is impaired after damage to. We have answered this already in our previous question. So who can answer this quickly? Then we move on.
Broca's area.
Broca's area. Language production is impaired after damage. When that Broca's area is damaged, then there will be a problem with language production. Question 36. Which of the following is not an anti-anxiety agent? Anti-anxiety. Alcohol, GABA, acetylcholine, barbiturate.
Alcohol.
What is alcohol doing there?
Anti-anxiety, not antidepressant. Not antidepressant, anti-anxiety. Yes, who said? Someone spoke right now.